Hello everyone, welcome you all in our YouTube channel Learning Radiology and start our today's topic. So today we will discuss our topic RF ablation, radio frequency ablation. So watch till to the end this video and like the video, subscribe the channel and press bell icon for a latest update. So let's start. What is the purposes of the procedure and what are the mainly purpose of this procedure? So RF ablation discrete the quantities of energy in the form of radio frequency and deposited in a specific body tissues and in an attempt to cause coagulative necrosis in a predetermined area. In RF procedure we use a RF probe, and this is our cancerous tumor, and this is our radio frequency heat, and radio frequency heat is generated by our RF probe inside our body tissue. Then it is help to damage the cancerous tumor. Means history of RF ablation at the time of 1982, closest chest catheter ablation of a AV node using direct current, means DC, and DC ablation uses 2 to 400 J shocked. They required general anesthesia. At 1987, first successful RF catheter ablation in a human. I performed an RF frequency ablation. Radio frequency ablation was the first used in the treatment of unresectable hepatocellular carcinoma. There are some indications for our RF ablation, like currently we use RF ablation used to treat some disease like hepatocellular carcinoma (HCC). It is also our first disease which is treated by our radio frequency ablation. Then colon metastasis to the liver, renal cell carcinoma, osteoid sarcoma, varicose vein, to destroy nerve tissue using heat, fibroids, cutaneous metastasis, and other tumors. Size and proximity of the adjacent organ limits the use of radiofrequency ablation. In case of preparation, there are preparation for radiofrequency ablation, like patient have fasting for 6 hours, intake insulin, aspirin also avoided. Patient have to wear loose fitting clothes. Patient can be procedure can be done as a outpatient basis. General anesthesia no use of general anesthesia. IV line inserted. Then mild sedatives are given for the procedure. The equipment, the basic equipment like RF probe, or RF probe is basically a metal needle, which is covered by a plastic material on all about, but not the tip of the probe. Means we covered all RF probe but except the tip of the probe, and it's made up of a metallic needle. The tip make direct contact with the tissue in the treatment area, and there are many different type of RF probes in use, but most common types are our Rita probe, and these are the images of our Rita probe. These are the covered images and these are the uncovered by a plastic area. Rita probe has 3, 4, 6 umbrella shaped. These are the shaped 3, 4, 6 umbrella shaped probes which can be deployed from within the tumor. Cool tip probe, which is a single or a multiple parallel probe that are internally cooled during the procedure by the closed circuit cold water pump. These are our cold tip probe. You can see they are our thermal zone, they are our surgical zone, dot zone are your surgical margin, and this is our target, and this is a needle of the probe, and this is our probe. This is multiple grounding pads are used to complete the circuit. These are Rita probe. Example of some different types of probe are like other than the Rita probe. These are the RF ablation machine which are used in a hospital. These are the images of our machine, RF probe machine. The pathophysiology of a tissue damage. The exposed tip of the probe emit radio frequency in the range of 460 to 500 kilohertz. means the probe which we use to diagnose treat the patient. The probe emit radio frequency range of 460 to 5 kilohertz. Then after energy excited the ion in the surrounding tissue, means radio frequency pulse go into the patient body. Then their energy excited the ions in the surrounding tissue, which through friction raises the temperature of the tissue. At the temperature above 50 degrees centigrade, the tissue literally cook in a vivo. The temperature is measured throughout the procedure by thermometers on the exposed tips of the probe. Means temperature, we use thermometer to measure the temperature of the exposed tips of the probe. There are process of cell death at the process of our RF ablation. Means firstly we denaturation of the protein, then after losses of the enzymatic function, then melting of the cell membrane, then after destruction of the cytoplasm. This event result in a direct cytodestruction of the affected cells. Then after, although some cells are destroyed at a temperature less than 49 degrees Celsius, other cell can survive temperature approx 49 degrees Celsius. Alternatively, when temperature exceeds 105 degrees Celsius, cell boils, releasing gas vapor and causing tissue charring. Then gas and charred tissue inhibit dispersion of the radiofrequency energy, which decrease the effective depth of the penetration of lethal energy concentration. Current method of RFA have increased the area of tissue necrosis from 1.6 cm diameter to 4 to 5 cm diameter. Temperature of 105 degrees centigrade for 10 minutes creates the ideal sphere. Time to return to body temperature indicates quality of the treatment sphere. Treatment area should include a rim margin of a healthy tissue to reduce the reoccurrence. These are the sphere of our ablation. Means these are our damaged area. The brown colors for the damaged area, and these are the healthy area, and these are the killed area. Means around every burn area is an area of the tissue that has been heated but not killed. This area is where most malignant cells evade the ablation. These are the CT guidance images. Post-ablation imaging like to correctly differentiate kill area of residual tumor. And this type of area, the kill area which appear hypodense and non-enhancing. Then the damaged area enhanced as there is a vascular permeability and inflammatory response. These are the CT images. You can also see these images. This is our lungs. Means CT with the contrast post procedure shows the area of hypointensity consists of coagulative necrosis. Some mild enhancement can be seen in the periphery, which may be represent residual tumor of the inflammatory responses. Summary for a procedure like RF ablation. Summary for an RF ablation is a minimally invasive treatment method to remove the cancerous tumors or a tissue or a tumor. This is a less painful. General anesthesia not required in case of RF ablation. It is very safe, simple, effective method for a treatment of tumor. It can be done on the outpatient basis. USG and CT imaging is very helpful in the RFA procedure. Okay, thank you. Like the video, comment on this video, subscribe the channel. We will make in next video. Till then, bye bye, take care, thank you.